Okay, we're live on YouTube, and now I'm going to hit go live on. Oh, I need to add a title. Oh, thank you for thank you for not letting me know that beforehand, Facebook. Hold on, let me get that in there. We are live on YouTube though, so hi YouTube. Go live. And I believe we are live. Although, yes, I think we are live. If you're in the chat, please let us know if we are live and you can see us, and if everything sounds okay. Maybe Kristin, can you talk a little bit just to make sure that your side's working?
Yeah, hi there, I'm Kristin.
Cool. Just waiting for someone to kind of acknowledge that. Hopefully we're live here, but I think we are. So we'll kind of wait for some people to straggle in a little bit here. And as we're doing that, I want to say thank you to Kristin. I'll introduce you in a bit, but thank you for being willing to jump on as my second guinea pig. I had Mark Johnson, of course, beforehand. You're related to Mark.
He's my uncle.
He's your uncle. Okay, so your mom, and we're going to be doing a Who's Girl Are You segment, so we'll go over all that. But on your mom's side, right?
Yes, on my mom's side.
Yeah, cool. Yeah, we do seem to be live, and looks like Cody says that I'm live. In the ALC community. Cool. And Judy says that she's here as well. And just verifying, we got a couple watching over on the YouTube side too. I mainly do the YouTube thing so that people who don't have Facebook will have access to this if they want to watch it. So kind of dual streaming to the two sides here, but great. Well, people are streaming in, but I'm going to go ahead and do a little bit of an intro. So I'm Jamon Holmgren. Whose boy are you? I'm Ron and Elizabeth Holmgren's oldest son, second oldest in the family. And I am doing a new interview series where I interview people with interesting jobs, life experiences, things like that, sort of unusual, especially in our community of the ALC and the circles of the ALC. I want to let you all know that it's okay to ask questions in chat. I'll try to read them to Kristin and see if she can answer them. I may not see all of them, so just kind of keep that in mind. And with that said, I'd like to introduce Kristin, Dr. Kristin Nordahl, who is, well, where are you living right now? Like, are you in Vancouver area?
My address is Ridgefield, Washington, but I'm actually on the battleground side of Ridgefield.
Okay, perfect. In Southwest Washington. And of course, the Who's Girl Are You segment. Who are your parents? Go ahead and introduce that.
My mom and dad are Arne and Lorraine Nordahl. Many of you may know both my dad and mom.
And you're the oldest?
I'm the oldest of 7. There are 6 girls and 1 boy in my family.
Yeah.
And that was kind of interesting because the 7th child came 13 years later after number 6.
Yeah, I remember that. I remember when she was born.
My mom was 46 when she had Heidi, which is kind of impressive.
Yeah, it is. That is impressive. That is very impressive. And you've lived in the Pacific Northwest. Is it all of your life, or have you lived anywhere else?
All my life. I've lived in Vancouver pretty much all my life. I lived in Seattle for a year, and I lived in Salem for about a year and a half, 2 years.
For your education?
Well, Seattle, I went to the University of Washington, and Salem, that was my first nursing job. So they had a internship sort of, so, kind of a mentorship. So you weren't just graduating and then sprung on your patients without any, care or guidance.
Right. Okay. And other than the dentist type stuff that obviously you do for work, what do you do for fun? What's kind of your go-to hobbies or anything like that?
So I would say that my number one passion right now is gardening, but I like to garden on, it's a little different than most people garden. I'm all about the soil. And so so I kind of view food as medicine, and what I'd like to see my soil get to the point where the foods that I produce are maximally nutritious. I kind of like the whole idea of being independent a little bit, but I would never ever live off grid. But that whole idea, it's near and dear to me. I've read a lot of books about all this stuff.
That's pretty cool.
My second interest I would say would probably be health. So while I'm outside, I have a place here in Richfield that's about 1.5 acres. It's a little over 1.5 acres. I have cows and chickens and ducks and cats. So just maintaining the property takes a fair amount of time. And so while I'm outside working, I always had to have headphones in, and I'm either listening to a podcast or I'm listening to an audiobook. So I'm able to get a lot of books read.
That's really cool. I when I'm out like mowing the lawn or something like that, podcasts are my go-to as well. Usually tech related for probably obvious reasons, but not always. Sometimes I've got something else going on. Barbara says, I'm here, but don't see anything. Is anybody else noticing any video issues? Hopefully it's working okay for people. But yeah, that's really cool. And you grew up in the area as well. So you've lived here your whole life. Let's talk about your journey to becoming a dentist. And we're going to start at the beginning. Did you go to high school and then just immediately go to college right after that, medical school, all that stuff? Or did you have sort of any in-between periods there?
Yeah, I went straight. In fact, it was in 1992. I'm going to date myself here. I graduated from high school. That was the year that Running Start began. So that fall, my sister Elsa, who's 2 years younger than me, entered Clark College. So she basically was entering college at the very same time that I was. I went to the University of Washington because I got some really nice scholarships that paid for my first year. But then it was kind of interesting. It's easy to get that first year of scholarships, but then after that, it's not so easy. And I can't remember what my tuition was, but you know what? It was a drop in a bucket compared to what it was today. So sure. I did take what's really cool. I lived with my grandma rather than live on campus. These were the days where it was very, very scary to send your child to college, to the big bad university. And you know what? It actually, it probably is big and bad now. I don't know that it was big and bad then, but it is now. And what I mean by that is that here you've raised your child in the nurture and the admonition of Lord, and you are going to send them out into the big bad world. And you know what? I think every parent has the right to be concerned, because what do we want most for our children? We want them to have faith. I mean, we want, like the Apostle Paul says, we want to, run the race that's been set before us. And we don't want to take our eyes off Christ. Well, yeah, for a young person, it's really easy. There's a lot of temptation all around. But anyways, I lived with my grandma. It was great. I look back on those times and I wouldn't ever trade them, because it was a valuable time. But let me tell you, the University of Washington as an 18-year-old was an eye-opener. I mean, it was, you're talking about classes. I went from high school, I was a salutatorian in my class at high school, to college where I was now one of 900 students taking, a general chemistry course. Right. And I mean, the stakes just were, I never studied in high school. I got well, all of a sudden now you're in college, and it's a totally different, experience. So, and then at the end of that year, I wasn't really sure that I wanted to continue. First of all, I was having a really hard time. I was pre-med, and I was having a really hard time getting the classes that I needed. So I needed classes like anatomy and physiology, and the wait lists were really long even back then. And so my mom was like, well, why don't you go to nursing school? I was like, Mom, I don't want to be a nurse. Right. But it was kind of good advice. She's like, you know what? You will be a nurse in 3 years and you can kind of figure it out. So what made me pre-med to begin with, so a couple things. So my Aunt Diane lived with us when I was young. So I want to say, yeah, Diane Johnson. She lived with us when I was, I want to say maybe 8 or 9 years old. And she went to the Clark College nursing program.
Okay.
And then when I was in high school, my cousin Leah Johnson, she was going to OHSU med school, and she was living with us. So here I am, and she's a radiologist.
Ben Johnson's,
Ben Johnson's daughter.
Yep.
Yeah, Ben and Carol Johnson. And so she became, she was graduating from med school at that time, and then she became a radiologist after that. But I kind of got to have like a bird's eye, so she kind of influenced me in some ways, but she told me, don't go to medical school, Kristin. And I remember thinking, well, why not? and for a whole host of reasons. There's good reasons not to go to medical school.
Right.
I mean, the way medicine is done in our country, I'm not 100% on board with how it's very, very pharmacologically centered. And you get 10 minutes with the patient, your patient tells you their symptoms and you're like, okay, I got a pill for that. Well, I would be, so now as a dentist and as somebody who's experienced, I know now if I went to med school, I'd probably become a functional medicine doctor. I would want to get to the root cause. So it doesn't mean that I wouldn't still be engaged if I had gone to medical school, but I would have probably found my niche in something like that. But anyway, so I listened to my mom. I'm like, okay, I'll go to nursing school, knowing that this was not going to be the last stop for me, but I just needed to figure it out. And so I did. I graduated in 1996. And then I actually ended up starting at OHSU in the dental program in 2004. So I had a bit of time. I worked as a nurse for a while. And then I was also, so I got my Bachelor of Science in Nursing. So I had done a 2-year program at Clark. And then I ended up getting a general science degree at Portland State University when I actually did figure out what I wanted to do. And I had to repeat some of my classes. And the reason I had to repeat those classes is because dental school has something very similar to the MCAT. It's called the DAT, the Dental Aptitude Test. And you're going to be tested on all these things. So I was tested on, chemistry, organic chemistry, biology, anatomy and physiology, all these things. So I needed to take those classes again so that I was up to speed. When your classes are 10 years old, it gets a little bit fuzzy how much you remember. But that was kind of my journey. What made me decide on dentistry, I would like to say that Howard Hillman made me decide on dentistry, but it wasn't. I was at Washington State University here in Vancouver getting my bachelor's degree. And in one of our focal groups, we were reading a book by Patricia Benner called Novice to Expert. And it just really cemented why I didn't want to stay in nursing, because I could have gone the nurse practitioner route. I could have become a nurse anesthetist. These are all kind of things a little bit on my radar, but ultimately I kind of decided that I did not want to work under somebody. I wanted to have my own license, and I wanted to be independent of somebody higher up, I guess makes
sense to me. I was gonna ask, like in high school, did you, obviously you didn't have dentistry yet, maybe fully on your radar, but you were thinking of becoming a doctor at that point, right?
I was thinking of becoming a doctor, and what was most interesting to me was maybe being an OB-GYN. I thought that delivering babies would be good. It's interestingly enough, I was asking one of the OB-GYNs when I was working as a nurse, I said, well, is it still exciting to deliver babies? And she's like, well, when they come at 2 a.m. And you've already delivered 10,000, no, it's not that exciting. And I'm like, oh yeah. So interestingly enough, from the medical community, where I was working at Peace Health, when I told them I had decided to go to dental school, I had so much support. They're like, oh, I wish I would have done that. That's
really, no kidding. That's very interesting.
Yeah. Well, I mean, here's the thing about dentistry. It's a tooth, right?
Right.
We're not talking about one brain, one heart, these kind of things. It's a tooth. You got 32 of them. If don't get me wrong, people are attached to their teeth, and I don't want to minimize the importance of teeth, but it's just not really life and death. It's just not really
generally speaking. That makes sense. But it's still something that impacts life. I'd like to get into that in a bit, but I want to talk a little bit more about your education there. So when you were when you were, you talked about how Running Start was really helpful. For those of you who are not in Washington, it's a program in Washington where during the last 2 years, like when you're a junior and senior, 11th and 12th grade of high school, you can, instead of going to high school, you can go to a college and get both your high school diploma and your, I assume, associates, or at least two years of classes in at the same time. Basically, the college classes will count for high school as well, which was a great program. I wish I would have taken advantage of it, but I was too like, I want to play basketball, and that would just make it tougher because I'd have to drive to Longview and all these other things, all these excuses. But you said that going there was a bit of a wake-up call, because in high school you could kind of float and you'd get straight A's pretty much, but then you got to college and you had to really work for it. So was it like a real grind to get through medical school?
So here's the thing. When you start out, so it's all relative based on your previous experience, right?
Mm-hmm.
So I had done nursing school, which was really, really hard when I went through it, right?
Mm-hmm.
And then you get to dental school and it's a totally different level. I mean, like the hardness, I mean, the caliber of student, I was among greats. I mean, these were very, very smart people.
Yeah.
And I was not at the top of my class, but I was in the middle, which is all good. And so, yeah, there's kind of a sobriety factor there. Like, okay, now if I really want this, I'm going to have to work hard for it.
Right.
And I don't want to minimize anybody's level of intelligence, because I would say that I'm average intelligence, maybe slightly above average. I'm not a genius by any means. And I know that from my SAT scores. But what I do want to say is it's really not about intelligence, it's about hard work.
Hard work. And
that's the one thing I think that we here have in the ALC community, is that we are taught how to work. Our parents are hardworking. I think that it's that whole stewardship, God has, instructed us to work to the best of our abilities. And I mean, I think it pays off. The other thing is I grew up without a television, and I would credit a huge amount of being able to focus based on that. I mean, I don't want to minimize that. The other piece that I think separates us, our community, from just the lay, is that once I got to dental school, I got to really see, out of 70 students in my class, maybe only 5 of the students had parents that were divorced. So that is a huge piece right there.
That's
is that
really
when
interesting.
you grow up in a environment that you have support. I mean, we lived in the same house for the first 25 years of my life, that there wasn't a lot of changes. And these are things that all help a student, because you go doing something hard like that, yes, it's hard on you, but you need that community of support to do that. And one of the other things that I thought was interesting while I was in dental school, one of the other gals was saying, is that in her AP history class, her teacher would every year ask the students how many of them were spanked. And pretty much all the students in the AP history class were spanked. In the honors history class, maybe half. And in the general history class, none. So I think that it's not, I'm not this huge advocate of spanking. I'm just saying that it takes discipline to do something hard, and you've got to somehow have these skills taught to you. And so that's where it comes in. Our upbringing and who our parents are and all these things really do impact our future success.
Yep. Yeah, I know definitely there would be a lot of factors there. It's a fascinating thing. And it is interesting because in the ALC, there aren't a lot of doctors. There are some, but there aren't a lot, considering we have very brilliant people, but probably, I would say, undereducated in general, compared to maybe a similar cohort. So it'd be interesting to dive into that at some point. Cody asks, I wonder if she knew Dr. Dick Park. He's one of my clients and he taught dentistry. I don't know if it was at your university. You went to UW.
No, I went to OHSU.
Oh, you went to OHSU.
Yeah.
Okay.
And I don't recognize Dr. Park's name.
Okay. And Stephen says she just really had to sink her teeth into it. Sorry, she had to readjust in such a demanding learning environment. Thanks, Steve. for that dad joke. And I'm sure she's heard them all.
Oh, I have. I mean, everybody has this war story of what their dentist did to you. I mean, every
Right.
day I have patients come in and say, and so, yeah, hopefully I'm not that dentist.
Yeah,
but I
exactly.
did have one patient later, and I knew that patient had only one extraction, and that extraction had been done by me. And I said to the patient, did the dentist put their knee on your chest? And they're like, yeah. I've never put my knee on anybody's chest. But
That's
this patient
hilarious.
thought I'd put their knee on their chest. It must feel like
funny.
that. It must feel very intense for them.
Well, I just had an extraction like 2 weeks ago, which is a great timing here. One of my wisdom teeth, I had up until 2 years ago, I had all 4 of my wisdom teeth, and my dentist kept telling me, you need to get those out of there. Because, it's hard to like take care of them properly and stuff. And finally one of them, got a little infected. He took it out. And then this other one, I said, well, let's take this one out now. And he didn't really want to do it because I don't know, but he just seemed a little reluctant. He's a great dentist, but he just seemed a little reluctant. I'm like, can you do it? I don't want to go to somewhere else, like you can do this, right? And he's, yeah, okay. Well, he starts working on my tooth, and he's doing, the pulling thing and like prying and stuff. And then he starts like raising the chair, and I'm like, well, aren't you going to take the tooth out? And he's like, here it is. He took it out without me even noticing. Like, I don't know. He did such a great job with it. I know that not every extraction goes that way, but yeah. So it went really well. That was helpful.
Dr. Hillman took out my wisdom tooth.
Okay.
Yeah.
So let's see. Go to the next question here. So medical school is a very long haul, and not only that, but you also took a little detour with your nursing degree as well. Were you like, how is it to stay motivated through that long of an experience? Like, first off, how many years were you going to college, basically?
So I kind of calculated it out one time, because I did have to repeat some classes just because of that. I went to school about 11 years full time.
11 years. That is a long time to go to school.
It's a long time.
It's like starting over in kindergarten almost.
Right. So I guess I found school not to be, I don't want to minimize, it was difficult at times, but I do enjoy learning. And so that helps, I think.
Yeah. And I was thinking when you were mentioning like biology and all of these other things that you were learning, I can see how they connect, obviously. There's some value there. But it's not just a matter of going to school and learning, okay, here's day one. Okay, this is how you pull a tooth. Like, that's not how this works. You have to get all this like background knowledge.
Yeah. So the mouth is connected to the rest of the body. Mm-hmm. So you have to understand disease process. One of the biggest things that I like to tell my patients, so there's 2 things. So there's a pH story with dental caries or cavities. So in the presence of acid, you get cavities. So there's several different forms of acid. You can get dietary acid, you can get stomach acid, or there's the bacteria in our mouth that then convert carbohydrates, easily digested carbohydrates, especially in the form of flour and sugar, to lactic acid. So that is probably the key piece, is that if we can control for acid, there will not be decay.
So it's not sugar itself. It's the acid itself. Created by
acid. And what makes soda so bad is that not only do you have the sugar, but you have the acid. So there's already the built-in acid. So it's like kind of a double whammy. Same with, energy drinks. And then the story that I have to tell my patients about periodontal disease then is that it's a disease of inflammation. So you've got your immune system that is now, it's a bacteria fighting machine. You've got this immune system that is now targeting your gum and tissues because of the presence of these microbes. And so what happens is you have bone loss. And then when you have bone loss, think of the foundation of your house being eroded away. Now you have teeth that are loose and you cannot chew with them. And so if people can understand the pH and if they can understand the inflammation, then I can give them the reasons why they need to care for their teeth in such a way. So that's
I like
the
that.
piece that I feel frustrated about is like, from a disease standpoint, dentistry is probably the 5th most expensive disease in the world, or dental caries, or the microbes in the mouth. So we're an industry that costs a lot of money. I know that most of the people viewing will readily agree with that.
Sure.
And so then but the problem is that there's not a lot of patient education in the whole prevention aspect of it. Patients are instructed to brush and floss, but really brushing and flossing is just such a small component of it.
Really?
The dietary component of it, it's like the rest of your health. If you eat a healthy diet that's good for the rest of your body, it's going to be healthy for your teeth. But, all the foods that promote disease, the heavily processed foods, they're going to also contribute to the oral diseases as well.
I could go really deep with you on that. That feels like a really interesting topic, but I do want to, Jennifer Volatile asks, what are your opinions of fillings with mercury?
Oh yeah. So amalgam fillings. It's kind of a mixed bag. So I've read a lot as far as the scientific literature goes. The exposure to mercury are when the filling is placed and when the filling is removed. So that is what you get the exposure to mercury. Mercury is much like every other thing. It's kind of dose dependent, right? So there's a level that is, I'm not going to say safe, but tolerated. And then there are levels that are not tolerated. And I think that, like anything, it kind of depends on the person. I don't want to say that amalgam fillings are bad. I have amalgam fillings myself. Frankly, I've never seen a composite restoration last for 50 years the way I have an amalgam filling last. I clench and grind. I need amalgam in my mouth. I need something that's going to be really durable and it will be there. And my amalgam fillings have been there for a long, long time. So I do amalgam fillings. I've never had a problem with it. My patients, I haven't ever seen a reaction to it. But theoretically, I think amalgam fillings, the mercury can be really bad. It can be very toxic. But I just don't want to say that the white fillings are not toxic either. They have BPA in them. They are basically a plastic. They're a resin composite, and they're not perfect either. But they are going to have to be replaced probably twice as often as an amalgam filling will have to be replaced. So
are there any other options, or is it just those two?
Gold, but that's a really old. I mean, people just don't do gold anymore. It's very, very expensive. Right. And the truth is that where it should be is in the prevention. If people can prevent having a filling ever. But the problem is that we get our 6-year molars when we're 6. And most people do not go in and brush their kids' teeth. They have their kids brushing their teeth. I would like for parents to brush their kids' teeth because that way you know that they're doing a good job. But yeah, that's not, I mean, when you have 10 kids, it just doesn't really work that way, does it?
Yeah. Or even 4.
Or even 4.
So did you come out of school with like a ton of like student loan debt, or was it like early enough that you could do this without, coming out with $400,000 in debt?
I was really, really lucky. I came, so all my previous schooling had been paid for. I'd worked all through college. So when I was at Clark, so first University of Washington was paid for by scholarships. And then when I was at Clark, I was cleaning houses for my mom and dad. And I was also cleaning houses for Carlson Development. I think we did quite a few of their houses. And then once I was actually like in Clark for a while, I started working at UPS. I worked at UPS for 3 years. And then I worked at Peace Health as an RN for 9 years. And then, so obviously while I was going to school, I was still working and I was able to pay. So I was basically working full-time, going to school part-time for a great deal that time. And that was really helpful. And I would recommend anybody else do that. Also, I was able to live at home for free. And that was really, really helpful. Yeah. But I know that you probably are interested in would I recommend dentistry to others. Actually, no, I wouldn't. And not because I don't think it's a fabulous job, but now new graduates are graduating with $500,000 to $1 million in debt. That is not sustainable. And so I don't know what we're going to do in America because I just had a young primary care doctor in my office on Thursday. And it's the same for her. She has an incredible amount of debt, and how is she going to pay it? So I don't know. All I know is that I make a decent living. I work at General Dental, so I am an employee dentist. I always thought that I was going to be my own boss and I was going to own a practice. But it just didn't really, like, God never opened that door for me. I had a practice that I was ready to buy. I talked to a CPA. And she said, you know what, if you want to make money, this is not the practice for you. You will be working really hard and not making very much money. I'm like, well, I don't want to do that. Then that's too stressful. And then COVID came. And so it was actually, it just kind of all worked out beautifully. So for that, I don't want to take away from dentistry. Dentistry is awesome. You get to do some really creative things. And if you're passionate about it and you want to self-educate, you can do anything. I can work as an oral surgeon. I'm not an oral surgeon unless you get the designation, but and I could do as much oral surgery as a general dentist if I want to, as long as you have the credentialing to do it. You're held to the same standards. It's the same with orthodontia. If I was passionate about orthodontia, I could be doing all kinds of things, for kids and adults. There's lots of general dentists that do that. So that's the sky's the limit for a dentist if you really want to. It's just, how are you supposed to survive, have a family, have a house, have a decent life when you've got this, monkey on your back of a debt that seems like, how are we going to pay this? I don't know. It just seems really, really sad to me that that's what it is. But I graduated from dental school with about $200,000 in debt. And I worked at a public health clinic, which was a federally qualifying health center. So I qualified for loan repayment. So out of that, 200,000, I got about 90,000 paid by the federal government. And it was a great program, and it is still available for people if they want to work in an underserved area.
Yeah. Okay. Yeah, that makes sense, especially underserved areas where there aren't as many dentists practicing. Well, there's again a lot more that we could go into there, obviously. But Steve Anderson asks, what's the doctor's opinion on saving one's permanent teeth rather than being quick to pull a bad tooth due to immediate financial concerns? I have found it might be better and cheaper to make an investment early on to save a tooth.
So again, obviously my big push is prevention. So if we can, for all of you out there that are not currently using an electric toothbrush, get one.
My dentist asks me every time. I'm like, yep, same as last time I got one.
I like the Oral-B. The second thing is flosser, get a water pick, because the water pick is amazing. And in fact, all patients with a bridge and all patients with an implant actually should be using a water pick. It's just hands down the best way to clean in between your teeth and around difficult to clean areas.
Better than floss.
Better than floss.
Okay.
Floss, especially for implants, floss will leave behind particles, and those particles can contribute to periodontal disease around the implant. So you want basically a water pick as a pressure washer, and you want to use it on the highest setting that you can stand. If you can tolerate using it on a 10, use it on a 10, because it does a really good job.
And it won't damage your teeth and gums and stuff. Okay.
No, they've done a lot of studies to make sure. So that being said, then you go to tooth decay or periodontal disease. So then we get to the point where think of your teeth like brakes. The sooner we can do an intervention, the better it's going to be for the long run. But now I've done an intervention, and what I am doing to your tooth is not as good as what God has given you. So now we're trying to patch a problem, and it's going to have limited success. So there's always going to be a microscopic open margin. I don't care what I do. If I do a filling or if I do a crown or anything, there's just microbial leakage, and that will contribute to recurrent decay. Again, this is where the diet comes in. So if you eat a diet that promotes a healthy body, you're not going to promote tooth decay. That being said, a tooth that needs a root canal, if there is enough tooth structure to save the tooth, I say save the tooth. An implant is at least $5,000 when it's all said and done, which sounds crazy, but you know what sounds crazy to me? a pickup truck that costs $70,000 that you're going to drive for 3 or 4 years. I mean, that
be
sounds
careful.
crazy.
The audience may take that a little personally, but
Right.
I
So
agree,
again,
though.
it's all about priorities, right?
It is.
I'm always so shocked. I ask, my patients, I can't afford an implant. Okay, so you have a cell phone, right? Yeah. You have cable TV. You go on these vacations. Okay, you can't afford an implant if you chose to. But again, I don't want to, and I don't want to be judgy here.
Sure.
We've all got our priorities, but the truth of the matter is that Americans spend more money on pet food and bottled water than they do on dentistry. And I don't want to diminish that. We are spending a lot of money on dentistry.
Sure.
It's just not coming out of our pocket. Most of dentistry is being paid for by our employer or by, some other program. So what's coming out of our pocket feels really painful, but it's not fun to pay for, a new crown.
Right. Yeah. It's not like you don't get the new car smell there, unfortunately. No. So that's fantastic. A lot of people, dentistry is one of the few things where we actually get to see a professional doing their job because we're there. We're the subject, right?
You're awake.
Yeah, exactly. But talk to me. What's a typical work week look like for you?
So I would say that let's just talk about a typical work day. So half of my day is spent doing hygiene exams. So I'm seeing people on an every 6 months basis. I'm reviewing radiographs if they were taken. My patient population, which is basically a 180 from what I used to see in Longview when I worked at the public health clinic. So that's been interesting. I'd like to talk a little bit about that. Not so much my patients are professionals. So I see, doctors and teachers and lawyers and nurses and, the gamut. Whereas before, when I worked in Longview, I saw people on some form of public assistance. So it was mostly Medicaid patients. And so you're talking about a completely different socioeconomic group, which was interesting to me because there's a lot of things that how I grew up took for granted. And that gave me a new appreciation for them. So now my patients, they actually are pretty affluent. They need an implant, they get an implant. They need, a new crown, they get a new crown. Whereas my patients in Longview, there just wasn't the financial means for that. So you try to save what you can. We ended up doing a lot of extractions. I got pretty good at extractions because, when it comes right down to it, if you can't afford to save the tooth, and really doing the root canal and then not doing the crown, it's kind of a waste of time because it's not if the tooth breaks, it's when the tooth breaks. Molars need crowns. Yeah. And so, but $500 is a lot of money for people to pay for a crown. I sympathize. I mean, if it comes to paying your rent, putting food on the table versus having a crown, I mean, yeah, I know. So back to the typical workday though, half of it is hygiene exams, and half of it is doing comprehensive exams. So these are new patients looking at patients that come in because they're having pain. So it's just a limited evaluation of a pain. I do a lot of fillings. I do composite and amalgam fillings, and I do quite a few crown preps, and I do a smidgen of implants. So I would say I probably do 2 or 3 implants a month, that sort of thing. And I'm not placing the implant. The implant surgeon, who is either the oral surgeon or the periodontist, places the implants. I restore the implants. So we're doing impressions. We're sending it off to the lab. We're having the lab fabricate the crown. I have a pretty strong preference for a screw retrained crown. So there's some reasons for that, but anyways, those are the types of crowns that I do. We have some new technology at my office, which is kind of cool. We use an oral scanner now. So we take a series of photos of the teeth and the tissue, and then the lab gets that sent via the.
Is that where you take it and you go around like that?
Yeah. It's that
my daughter
technology. Yeah.
Yeah. My daughter actually does it with our phone somehow for her orthodontist. But yeah, it has to go around like that in her mouth. It's kind of it's kind of crazy, but
it's pretty cool stuff. So, but all these technologies, they cost money. So this particular intraoral scanner that we have is a $60,000 package. So, I mean, it's, those of you out there that have a dentist that has a steric machine where they actually mill the crown right there in the office, those are, they start out at $100,000. So you think that, your dentist is making a lot of money off of you, and I don't want to say that they're not. I mean, they're doing fine, but just keeping the lights on. I mean, where I work, I mean, the rent is, I don't know, it used to be $10,000 a month, but I know it's gone up. So just these things, and then plus now in COVID times, we can't get staff. Oh my goodness! So everybody's having a hard time getting qualified staff, and so you're running short, and so things just cost money.
For sure.
I'm sympathetic though. It does cost money. So it's prevention, right?
It's every industry. I don't know if I even want to talk about mine, how bad things are. It's something else. Susan Questad Carnes says, what is the best water pick to purchase? I have had bad luck with that.
So I don't use a water pick myself. My hygienist is the one that uses the water pick. I do still use floss. I don't have any other issues. So I'm not real versed. The water pick that we like is the one that you get at Costco. So it's a combo package. It's usually on coupon for $90. You get the tank that I think is the Irina, my hygienist, likes the tank better than the portable one, but the portable one works quite nicely in the shower or when you go on trips, that sort of thing. The reservoir is just much, much smaller. So I guess like anything, it breaks. Don't put anything besides water in the tank. You want to clean it with some vinegar, clean the line with some vinegar. But the idea is that you take this and you go along the gum line and you pause for 3 seconds in between each tooth. And so if you're still getting stuff out, go back and do it again. I mean, you want to get it as clean as possible. So I guess I'm not totally sure what her problem. Give me more information.
Yep. Your Aunt Carolyn asks, what about all the x-rays they take at the dental office? Aren't they dangerous?
Good question. So I do get pushed back a lot from the x-rays, but I will tell you this, our digital format now that we use uses way less radiation. So you're talking about a full series of x-rays, that's 18 pictures, being the equivalent of being out in the sun for a week. So, and then think about it, those who fly a lot, the higher altitudes, you're going to get more radiation. So it's like, a couple of cross trip country, it's, so I don't want to minimize it. There is some radiation, but I'm just saying, like, compared to what it was, 30, 40 years ago, this is nothing. So don't be concerned about it. Again, the radiographs are really important for early detection of problems. That's why we do them. If I can't, like, I have patients decline x-rays and I try to give them the information, but if they decline them, I'm really only doing half of an exam because it gives me that much information. I can't see in between the teeth. So the x-rays are what help me to see in between the teeth.
Steve says, I'll be buying an electric toothbrush and water pick. Really appreciate this interview. That's awesome. So let's see. I want to call back to your nursing for a second here. Do you think that was helpful to you later on once you started, once you became a doctor and started taking on the responsibilities of being a dentist? Do you think that your nursing experience was then helpful at that point?
Yeah. So first of all, I know my pharmacology. So all those drugs, I know them. But also, I got to see disease systems, at the end stage. I saw I saw what happened with heart disease and stroke and dialysis patients and cancer. I see all these things, and my patients, they've all gone through these things too. Some of them are very, very sick. But further, because of my nursing background, I feel like I have a better understanding of how the body works. And so there's so many interventions that I can do because I can speak to them. For example, when my patient has high blood pressure, I can talk to them about why they need to have their blood pressure managed. And it's these little things like, look, when you have uncontrolled blood pressure, it's affecting the microvasculature. So the smallest of your blood vessels, which are found in your eyes, in your brain, in your kidneys, you do not want to damage those areas. My sister Inger was just telling me about a patient, a young woman, 22 years old. The background on her, she did only have one kidney, but because of uncontrolled hypertension, she's now on dialysis for the rest of her life. She was having a shunt placed for dialysis because she lost the function of her kidney because she didn't know about it. And you don't feel bad with hypertension. You don't, I mean, it's one of those diseases that it doesn't cause any pain. You don't really feel it. So when my patients are running around and they're not having these things taken care of, they're not on medications or whatever, I have that conversation with them. The other thing is like sleep apnea. I mean, that's all on us dentists' radar now, is because think about it. When you're sleeping and you're hypoxic, that means that your tissues are being deprived of oxygen. Well, that does a lot of damage through stress. It raises your cortisol levels. It contributes to weight gain. It also damages your brain. I mean, your brain's not getting oxygen. So these are things where I can have a conversation with my patient and I can give them some more, information. And I tend to have more time than maybe a primary care doctor has.
That's true.
To give them this information so that they can maybe make some positive. So because I'm in the mouth, I have to ask a lot of these things. And one of the first places that we do see diabetes is in the mouth. I mean, it affects the gum tissues. So these are things that have been enormously helpful because I have a lot of experience from my nursing career to draw on.
So I'm glad you mentioned all that. I have hypertension, or at least, I don't know, I guess I have hypertension. I was diagnosed with it. So I take medication for it. It runs in my family. And you're right. I didn't feel any different. Steven says hypertension is the silent killer. I know I've heard that before. But it was definitely like consistently high, and the medication, at least according to my doctor, really doesn't generally cause any real issues. Like, you can be on it and it'll just mostly just reduce your high blood pressure. I mean, all medications have some downsides, but for the most part, it's pretty safe and well tested. I was like, how could I have high blood pressure? Like, I'm active, I play hockey, like, but some of it's hereditary and whatnot. You mentioned sleep apnea. It's not just like, there's a kind of I think a misconception that it's mostly like overweight people that deal with this. It's not true. My wife is very slim and beautiful and everything, and she has sleep apnea and she has to deal with that. So she uses a CPAP. I've told a lot of people, like, this changed her life, to go on the CPAP machine, even though it's a real pain. It's a major pain, but once you get used to it, it's all right. And it'll change your life if you're dealing with sleep apnea. And later on, like, all the damage you're doing to your body, it's just going to be much better to deal with it up front, like you said.
Yeah. So one other thing that this is a little bit of a soapbox of mine. So I get it as a dentist. I have a lot of patients come in, not because of the way the Washington law has changed, and they're not drug seeking anymore for narcotics, but they are drug seeking for antibiotics. So then I have to have a conversation with my patients about why I don't want them to take an antibiotic. So don't get me wrong, antibiotics are wonderful drugs. They have, I feel like they have totally transformed, life as we know it today. However, there's a downside to antibiotics, and especially early childhood antibiotics. They destroy the gut biome. And now we're seeing more and more science coming out where people are having lots of mental health issues, as well as other issues, and it's because of their microbiome. So I just read an article, I sent it to my family yesterday, about a woman who cured her depression by taking a probiotic. And I'm like, yeah, go girl, because I agree that these are things that we don't understand. It goes back to the soil. The soil to a plant is much like our gut is to us. And when you have about 80% of your serotonin made in your gut, I've heard on upwards to 95%. We know that our gut affects our health, and not just our physical health, but our mental health.
Mental health as well.
These are things that when my patient willy-nilly wants an antibiotic, I'm having tooth pain. I know you won't give me a narcotic, but I want an antibiotic because that's going to fix my pain. I tell them, look, this is not what you do not want an antibiotic for pain. You want an antibiotic for a life-threatening infection. If it's not life-threatening, you need to just get treatment, either
Yeah.
have the
Yeah.
infection treated through a root canal, an
Mhm.
extraction, a dental cleaning, probably
Yeah.
more like a deep cleaning. These are the things. But if we can avoid doing antibiotics, we need to avoid doing antibiotics.
It's interesting. I just had a meeting. Was it yesterday or today? Now everything's blurring together. I just had a meeting with a startup out of the San Francisco Bay Area. And I don't think they'd mind me mentioning who they are, but it's called bettermeal.ai. And they are focused on gut health. And they are building an app and doing some like data science and artificial intelligence that helps map nutrition to like basically food markers with gut health markers. And so they're basically saying, okay, to have a healthy gut, obviously there's like probiotics and stuff, and those are great. Like honestly, I feel like everybody should be on probiotics, but then there's also the foods you eat. And you mentioned this earlier when we were talking about your gardening hobby, about how certain foods affect your gut health, and how everything seems to lead back to the gut. There's always like everything, I've talked with my sister Kendra about this. She's very passionate about this as well, about how gut health has been very misunderstood for many years. And it's now coming to the forefront. Like this is more important than we thought.
Yes. I mean, it's because we don't see these guys, but they are enormously important to our health. And so when you take, a week, 7-day course of antibiotics and you're diminishing your gut by about 50%, I mean, we don't want to be doing this. So, I mean, don't get me wrong. Now, if you have a life-threatening infection, I mean, an antibiotic is, we want to give this to you, but too many. And you know what? I still see it with my colleagues. They still have that pro-antibiotic mindset. The other thing that the American Heart Association has come out with different guidelines, but it used to be we give prophylactic antibiotic, meaning that an hour before your appointment, you take this, 2 grams of amoxicillin for your dental cleaning. And we've all got away from that. And that was just because you had a hole in your heart. Well, there's not really any science for that. And in fact, now the only time we really give prophylactic antibiotics if there's a history of endocarditis, which is an infection of the heart valve, or if you have like some sort of artificial valve. We just don't want to give you a prophylactic antibiotic. This is coming from the American Heart Association and the American Dental Association. Well, now the American Orthopedic Association they want their total joints, total hips, total knees to have 2 years of antibiotics prior to a dental cleaning. And the American Dental Association does not agree with that. So I don't prescribe. And then I have the conversation with my patients why you don't want to do that. You do not want to take an antibiotic for a very, very low risk procedure, because the dental cleaning is much like brushing your teeth. I mean, the amount of bacteria getting into the bloodstream, it kind of depends on you. If you have a pretty bad periodontal disease, there's going to be some microbes getting in, but I don't think that it's really any different than brushing your teeth yourself. So if you've got bad gums, you're introduced to microbes. So I just don't think that we can't just give antibiotics willy-nilly to our patients. There needs to be some really good reasons.
It's so complex. Like the body is so complex, and we are finding out all the time new things. Naomi Loftus says, my cardiologist has always said I don't get to not take care of my teeth or not go to the dentist because an infection of the mouth will go straight to my heart.
Yeah, it can. I mean, those microbes, they float around in our blood. And think about it. So if you go to the dentist and when your hygienist is doing your probing, so all those numbers, those 323s, all that stuff, that is looking at the inflammation. If you're having bleeding on probing, and sometimes I know it feels like you're being stabbed, but that is inflammation. If your gums are healthy, you will not feel like you're being stabbed. So if you're having pain with the probing, that tells me that there's a problem right there. And how you get rid of the problem is you remove those microbes that cause that inflammation. So when I have a patient that comes in and their gums are pretty bad, basically you can take your palm and you add up all those surface areas, you've got an open lesion the size of your palm in your mouth. And well, that's how bacteria gets into your bloodstream.
Yeah.
So we don't want that. That inflammation is bad because it raises systemic inflammation. And I can't say that inflammation in their mouth, like there's causation for diabetes, Alzheimer's, and heart disease, but we know that there are indirect links. So I think that causation, it might be there. It's bad. And so my goal for all my patients is no bleeding in the mouth. If you see bleeding, that means you need to clean that area more frequently.
So Naomi follows up and says, interesting. I was hoping I didn't have to take antibiotics before dental work, but nope, my mitral valve has been replaced. So, but I think to your point, Kristin, if you have had heart issues or had, valve issues or whatever, your dental hygiene needs to be pretty good. Like you need to be really focused. Everybody should, but especially those people, because that's a road right to your heart.
That's right.
Yeah. So Sue says, Sue Matson says, this practice of giving an antibiotic for a heart murmur ruined my health. When I was in my early 30s, I ended up with a stomach surgery for a massive yeast infection. Many years later, gut health is important to me.
Yes.
Yep.
Yes. So she's one of the people that we've learned from, like that we just don't want to willy-nilly give people antibiotics.
Right.
It does damage.
So both Cody and Stephen asked about mouthwash. Do you have an opinion about mouthwash?
So I'm not a huge proponent of mouth rinses just because I don't really feel like they do that much. Although I do recommend a bleach rinse for my patients, especially if they have a lot of dental caries or periodontal disease. And this is a really cheap mouthwash. If you guys want to write down this recipe, it's 1 cup of water and 1 teaspoon of Clorox bleach or household bleach. And you swish with it 3 times a week for 1 minute.
Did you say teaspoon?
1 teaspoon. So it's
not a tablespoon.
Not a tablespoon. Although, you know what, frankly, if you can tolerate a tablespoon, more power to you. But that would be a really.
The doctor just told you to take Clorox bleach, everybody. So just letting you know.
And that is a rinse. That is not a swallow.
Yeah.
1 teaspoon in 1 cup of water is much like swishing with pool water. And what they have found is it just changes the microbes in the mouth, especially for somebody who has a propensity towards decay. Or periodontal disease. It can really change the microbes. I think it's kind of dangerous, like for somebody who doesn't have any tooth decay, don't do it because you don't need to change the microbes. But if you do have, like these are the patients that come in and they tell me every time I go to the dentist, my dentist tells me I have cavities. Well, then we should do something about it. But otherwise, I say don't willy-nilly just change the microbes. But if you have a propensity towards decay or if you have periodontal disease, it's a wonderful mouthwash. And I would recommend that over something else. So a lot of these other mouthwashes, I just don't, I think that their benefits are maybe placebo. I mean, maybe they're good. I don't really know, but I just know that brushing and flossing is where it's at.
It's been kind of back and forth because I remember a few years ago that Listerine got in trouble for saying that it could replace flossing and things like that. So there's been some controversy around that, I think. That makes sense to me.
I do think that the water pick can replace flossing. I do believe that. So I don't think that you have to do both water pick and floss.
I think you've probably answered some of this already, but what are some common misconceptions about dentists and dentistry?
Oh, well, I think that one of the biggest hurdles that dentists are up against, and I think that the dental community is part of the problem too, is that this idea that the mouth isn't connected to the rest of the body. So we are doctors, and as far as our utilization going forward in the future, I'm not totally sure how this is going to work, but I think that dentists need to step up. We're primary care providers. We need to be doing the education. We need to be checking blood pressures. We can be doing vaccinations. We can be doing all these things that helping out with the healthcare effort. So that's probably the one thing. I
was gonna say my dentist, who's fantastic, love the guy, and I don't want to get into any debates about vaccines or anything, but he had mentioned to me that, this is early on in COVID. He had mentioned to me, like, when a vaccine's available, I could be giving it. I'm a doctor. And I was like, yeah, there's one on every corner, right? Like, this is actually a very accessible thing. And then I was also going to ask you about the blood pressure thing, because you go to a normal doctor, I say normal, a family doctor, and they'll take your blood pressure, but that doesn't happen at the dentist. Is that just sort of for like practical reasons, takes time, or is there any reason for that?
I think
or you think they should?
I think they should be checking your blood pressure. I mean, if not every time, at least once a year, they should be checking your
like
blood
at the exam, right?
At the exam or
the X-ray, I should say.
Yeah. So I just think that's a good way to, because there's a lot of people out there that don't go and see their doctor if you're healthy. I mean, the only time you're really going is maybe going and seeing your dentist.
So it could be prevention rather than just treating when something's wrong.
Yes. So here's the problem in America, and this is the same in dentistry. We're not paid for prevention. We're only paid if we do surgery in your mouth. If my hands are in your mouth with a handpiece, I'm making money. If not, if I'm just talking to you, there is no money being made. So all that education, that is not billable.
I remember a former dentist years ago saying, "Oh yeah, you don't have to brush your teeth. I always wanted to go to Hawaii."
Right.
Joke about it. Like, yeah, if you don't brush your teeth, it's just more money in my pocket,
I would say to my patients in Longview, I'd say, "Oh, you like Mountain Dew? Cha-ching."
Oh, that's, yeah. It's, and I guess along those lines, like, you, like, dentists sort of get this, I guess, like, reputation of their sort of nagging about stuff, like, oh, I know I need to brush my teeth, and but as you've been explaining, like, it's because they see the fallout of it.
Yes. However, I don't think that when you're dealing with adults, I don't think that anybody should ever be shamed for what they do. So I have a patient she's a nurse, and she has been shamed by every provider that she's ever come in contact. She has some autoimmune issues, and her gums are not healthy, and it's not because of what she's doing.
Right.
So, but for me to shame her, she's an adult. What purpose is there? I cannot reach people through shame. That's ridiculous.
Shame is kind of a poor motivator, really.
It's a really poor motivator. And I don't even know how much it works for kids, but I know that we as parents, I include myself in there, not that I'm a parent, but I'm an auntie. The shame thing, we do try to use that. It's one of the tools in our arsenal, but I think it's a weak tool, and I think we should avoid it. So rather than shaming my patients, I really try to be supportive of them, understanding, and frankly, educational. And frankly, if you don't want to brush and you don't want to floss, it doesn't really affect me at all. It is your mouth, it is your body. You get one, and you can do what you want. And me shaming you for not taking care of it the way you ought to, there's no point in it. So I don't do that. But, and I don't think it's healthy.
But people need the education to know what the decision they're making, the impact of that. Yeah, that makes sense.
I do. Yeah, I want people to at least be informed, and then they can make the decision. And generally speaking, I mean, most of my patients, if they're given the correct information, they make the good choices. So for example, I can't tell you, I want to go back to the electric toothbrush.
Yeah.
With a manual toothbrush, an ambitious brusher, like somebody who's really diligent, you can maybe get 700 brush strokes per minute, maybe. And I kind of even doubt that. But with an electric toothbrush with zero effort on your part, my Oral-B has a deep clean mode of 60,000 brush strokes per minute. I mean,
really?
No comparison. Why would you ever want to use a manual toothbrush? It doesn't make any sense to me. Well, I have parents tell me, well, I think it's good for my child to learn how to brush their teeth. I'm like, yeah, why? They're just going to get cavities. Just get them the lazy man's tool. It does a better job. And I mean, let's not. So anyways, I just think people have these interesting ideas about things.
Very true. I've been using an electric toothbrush for a while, and I won't go back. It's so much easier, and my teeth do feel cleaner at the end of it.
It's a small investment. It's $100. You're
Yeah.
talking about, getting a filling that then
That's
turns
one
into
filling,
a crown or it turns into a root canal.
Not even.
I mean, yeah, you're looking at several $1,000s. So
Yep. So how has dentistry changed over the last 5, maybe 10 years at most, but like in more recent time?
well, I think that again, it's the push for prevention. So I think that I really want to help my patients not have disease. And so that's where the piece comes in. And while I'm not being compensated for educating my patients, I really think that it's important.
Yeah.
I don't see how we're going to change anything if we just, if all I do is just address the problems, I don't really feel like I'm doing anything to prevent them. And that's, I think, that's the piece. If I can't give the education, then we're not going to do any prevention. So I focus on that. I think a lot of other providers out there do. I don't know, I know our audience today, I mean, it probably is all ages. So I think that that's probably the piece that's changed the most. But then again, too, we have more information about how things contribute to disease. So maybe that's why we know more, so we can share more. I don't know. But I think that technology has grown too. We have some amazing technologies out there. We have some really good restorative materials, but really, when it comes right down to it, prevention is still the best, because what God gave us is still the best. Now, Matt, I want to say a piece about the orthodontia component. So I'm a little bit more on the natural end of things. So I think a little bit of crookedness to people's teeth looks great. I think that having a Hollywood smile is actually not as attractive as maybe what some people, but what I do like about early intervention orthodontia, and I mean that in that I think kids should be seen by an orthodontist and be evaluated starting at the age of 7, is that we've got airway issues. So our standard American diet is so refined that we do not chew our food like our ancestors chew their food. We have flours that grind the grain up really fine, and we have meats that are ground and tenderized. So we don't do as much chewing, and so therefore we don't have as much jaw development. So what you see is a classic presentation, and this is the epigenetics. When we did that, we mapped out the human genome. You got DNA, and we thought that was going to be kind of the answer to so many different things. But what we didn't understand is that the epigenetics, that's how the DNA is expressed. It's expressed in the environment that we encounter. So therefore, our jaw development is affected by the foods that we eat. Well, we're not chewing very much, so our jaws are underdeveloped. And so that's where this early intervention orthodontics comes in, is that we want to make sure that the jaw is big enough that there won't be future airway issues. So I really want my patients, my parents to get their children in sooner, especially if there's a history of sleep apnea in the family, because you can take advantage of that jaw growth. And when the upper jaw is expanded, that lower jaw will grow into that. And so you don't have as much, basically that small lower jaw. So when you have a really small mouth, you have a really small airway.
Yeah, it makes sense. And these are things that will throughout the rest of your life are going to be beneficial if you can take care of them early.
Yes.
Okay. Jennifer Volatalo says, I don't know if we want to get into this. We're definitely continuing to go long on time, but she says a brand name toothpaste doesn't have fluoride in, as they say, we respect our customers' diverse needs and interests, but has sodium lauryl sulfate in it. That's in shampoos and soaps. Do we want that in our mouth? Your opinion on fluoride and on sodium lauryl sulfate.
So I feel that topical fluoride is very safe. I think that ingested fluoride gets a little bit of a gray area, but I do know that dentists that come and practice in Oregon, because our neighbor here in Portland, Oregon, does not fluoridate their water, are just absolutely shocked at how much tooth decay there is. So we know that fluoride does help. We know that fluoride is dose dependent. So there's a finite amount that is healthy and safe, and then there is the amount, much like water or sodium or all these things, where it's actually toxic. So I think that fluoride, especially in a topical application, is really, really helpful. And in fact, my patients that have had a lot of dentistry, like some of my patients have 14 crowns in their mouth. I want them on a prescription strength fluoride toothpaste at nighttime, just a small amount, just a little lentil size amount that they brush on for 2 minutes, spit, don't rinse. I want that to sit on their teeth while they're sleeping, because every single one of those crowns has a microscopic open margin. On an electron microscope, you can see it. It's wide open, and microbes can get in there. So those are the people that I think it's very helpful for. As far as
sodium lauryl sulfate.
Sodium lauryl sulfate, I have my patients avoid sodium lauryl sulfate if they can. It has a pretty high allergenicity, and we're just inundated by chemicals in our environment. So like the toothpaste that we use and all that. Again, if you're not having any problems, you don't really worry about these things. But if you're on the autoimmune spectrum and you've got issues, you need to avoid these things. So I think it's going to be kind of a case by case basis. But yeah, if you can find a toothpaste that doesn't have the SLS in it, more power to you. And then there's all the parabens. There's all these other things that go into these products. They're to be avoided. They're chemicals that cause, they're estrogen mimicking chemicals, and they cause problems. So I don't know. I mean, like as far as it's a case by case.
Fluoride, it can be obviously controversial, but I remember my dentist saying the same thing, where like for a while we were living at my in-laws, John and Dolly Matson, and they're on well water. And he said, if you're on well water, I want you to be taking these fluoride things, chewing. I don't know. I forget exactly what it was, but it was like, you're going to get a lot of cavities if you, in the time that you're there, if you don't take care of your teeth with fluoride. So that was his opinion. Jennifer says, thank you for the information. And I want to ask you two questions. I'm going to ask you both questions at first, and you can answer whatever. One is, what are the best parts of the job? And then number two is, what sucks about the job? What's not so great about the job?
Well, what I like best about the job is I feel like I'm helping people and I'm helping them better their health. What sucks about the job is that I actually have to go to the job. I mean, there's like, work is work, right?
Yeah.
So I on one hand, I just feel really, really thankful to have such a great job. And then on the other hand, it's kind of like, well, but I have to work.
You have to get up and go do it.
I have to get up and go to work.
Yeah.
We work as a team. So that's one of the things I really like. The idea that the doctor is at the top of the food chain, maybe a little bit. I mean, I think that I get treated better by, the staff, my staff, they want to make me happy. My patients don't want me to hurt them. So there's that, but really I can't do my job without everybody else. So, again, it takes all of us to deliver care. I mean, it takes the gal at the front who knows insurance. I mean, she has a really, really important function. My dental assistants, they do amazing things. And I got this young dental assistant. His name is Aiden. He's about 24 years old, and he is just so technologically savvy. I mean, like we have this, like I said, this new intraoral camera and the scanner. And I mean, he is like so good at it, so much better at it than I am. Mm-hmm. And so these are the kind of things like, I don't think he's going to be with me too long. I've had him there for about a year, but he's too good to be my assistant. And he should be the dentist. And I told him that too. He should be the dentist. But he's taking my advice. I told him don't go to dental school. It's just too expensive. And so he agrees with me. I mean, it's $500,000. Ouch. It's just too much.
Why? Just a quick little interjection. Why aren't there like physician assistant for dentistry?
Oh,
you know what I mean?
They're trying to get that.
Oh, really?
Trying to get that. Yeah.
Okay.
So, but it's not a physician assistant. A physician assistant has so much more education than what they want to do. So this is like a 2-year program, and they want to be able to put these people, and I can't remember the terminology for them now.
Okay.
They are, but anyways, they really would like to have them in remote areas, and then you would have like a Zoom. The state of Washington, they're
almost like a medic in some ways or something like that, but for teeth.
Yeah. But there's so many things that a dentist does that I just wouldn't want somebody with a 2-year education doing in my mouth. I wouldn't want them removing my tooth. I wouldn't. So I don't know.
Like maybe just like cavities and taking x-rays and looking and things like that. Maybe, I mean, there's some opportunity for technology here where they can send the x-rays to a central dentist or something that
Right.
can review them or something. I don't know.
Right. Right. Yeah, no, I think it's coming.
Yeah.
That this is coming, but I don't know. I mean, because again, we $500,000 for an
Yeah.
education. It's just, and then, you know, the cost of dentistry is then driven by these things.
Sure.
It becomes, you know, more and more unaffordable. But
Mhm.
there's some things that I wouldn't want that person doing on me. Then there's
Yeah,
other things
makes
that
sense.
they totally would be qualified to do. So, and then the other thing is that I know what they call them. They call them a mid-level provider. So
Mid-level provider. Okay.
yes. So the idea is that you would allow these mid-level providers to practice and that they would be in these remote areas. But I don't think it really works out that way. People don't want to live in remote areas.
Yeah.
So what's going to make people, you know, especially as people get an education, there's a quality of life that they want to have.
Right.
You make these sacrifices and you want to be near, you know, entertainment and restaurants
Sure.
and things like that. And so people don't necessarily want to live in the bush of Alaska, even as a mid-level provider.
Yeah.
So I don't know what the answer is. I just know that if that's changing, we've got a lot of opinions about how the direction of dentistry is going to go.
So going back, what sucks about the job? I guess you already mentioned just the
yeah,
you know,
well,
it is a job. And
so it is a job. I do feel a little frustrated with the unrealistic expectations that some of my patients have. I in particular don't enjoy doing dentures. I'm not good at them. So I tend to send those cases to, I have a couple of colleagues that are willing to do that. So and that is one of the things that, so for example, this is my plug for taking care of your teeth. A denture is just, it's got about 20% function of your natural teeth have. And so it's like having a hockey puck in your mouth. So there is a level of accommodation. I mean, we're humans, we accommodate to things, we adapt that you can do. But I mean, to me,
a hockey puck right here, just for illustration purposes.
Yes. I mean, to have something like that floating around in your mouth and you have to manage it with your tongue, you have the entire roof of your mouth covered. So an upper denture is actually pretty decent, the suction and retention, and they look amazing. I mean, a lot of these patients go from, you know, a very unattractive smile to a very attractive smile, but then it's that lower denture now. You got your tongue in the way. So you've got that just like horseshoe amount of bone. And think about it. This is what happens when you have all your teeth removed, is that you lose bone. So the most rapid bone loss is in the first 6 to 8 months of a tooth coming out, but you have all your teeth out, you lose a huge amount of bone and it doesn't stop going away. I mean, you just, each year you have less and less bone. And so when you don't have very much bone on the bottom, that means you don't have any bone or tissue support for that denture. There's no suction, it floats around. And so your tongue has to manage that.
Makes sense. Yeah. I've pretty much run through now. I just really quickly, your sister Elsa is also a dentist. Is that correct?
Yes. So here's what happened. We went to nursing school together.
Yeah. Right.
And then we were both at WSU, which is Washington State University, and we were taking that class together, and we were in that focus group. And Lori, she's a gal that I worked with at Peace Health. It's now Peace Health. It was West Washington Medical Center. She was just talking about her sister. She's like, yeah, my sister just graduated from the University of Washington and she loves it. She loves dentistry, and they had an amazing class. They all went on a cruise together. She says dental school was fun. When I heard dental school was fun, in my mind, I heard dental school is easy. So I was a little bit surprised. So Elsa was like, you know, I'm going to do this. I'm going to go to dental school. And I'm like, oh, okay. Well, I guess I'm going to, because I wasn't really sure. I was still kind of playing around with the idea of maybe going to law school. I knew I wanted to do something besides nursing. I hadn't completely ruled out medical school, but I just wasn't sure. But when she's like, I'm going to dental school, I'm like, well, okay, I guess I'll go to dental school too. So here's the thing that makes that so nice. So we took all of our prerequisites together. So having a study partner is really good.
Wow, that's amazing.
we're different personalities. I would say that we're almost polar opposites. Elsa is one of those people that she will make it happen. And I'm more of the talk. And I like to, like basically when I'm studying for an exam, I've never had such a clean house and I've never had such a house full of good food, because I need to, procrastinate as much as I possibly can.
You productively procrastinate.
I try to product, because that's how you justify it in your mind. Like, oh,
yeah. Well, I got to do this. Yeah.
Whereas like Elsa would be like, I'd be like, oh, hey, Elsa, what are you doing? She's like studying for that physics exam or something, whatever. I'm like, oh, I better be studying. So that was really helpful, because she kind of motivated me. And so then when she said, oh, I'm going to dental school, I'm like, oh, okay, well, I guess I'm going to dental school too, because I didn't want to be left behind.
Right.
Well, it ended up, it's interesting, like when you look at us, you compare us on paper, she and I have pretty much, our grades are very similar. Our paper resume is very, very similar. But one of the pieces for the dental school application is that you do an in-person interview with one of the professors. And the particular professor that she was interviewed with, he's a neurophysiologist. He's a little bit on the dry side. And so she's a quieter person than I am. So I think that he and I would have connected, because I'm kind of interested in some of this brain neurophysiology, and I read quite a few books on it. But she and him, they didn't have that meeting of the minds, you might say, whereas Dr. Benninger, who's the A&P professor at the medical school, he interviewed me, and he's a doctor and he worked, in the UK. And so, my being a nurse and him being a doctor, we had a lot of things to talk about. And so I think that was the really one piece why I got in 1 year before her. So I ended up graduating in 2008 and she graduated in 2009, but it was really nice because I got to know some of her classmates, and they're some really good friends to this day.
That's great. Yeah, that's fantastic. This is very cool. And I'm not even really sure how to word this question, so forgive me if I do it wrong, but did you ever feel any like weirdness around being a professional woman, highly educated in the ALC? You know what I mean? Like that, it wasn't always very, I guess, encouraged in some ways in our culture. Was there any weirdness around there, or did you feel mostly just support?
I felt support.
That's great.
My dad gave me a little bit of pushback in that he's like, do you know how much money you're going to be losing not working? And I'm like, but Dad, I'm just out of time and money, right?
Yeah.
So I didn't ever feel, maybe if I was born into a different family, it would have been different, but my family is quite pro-education.
Yeah.
All my relatives, my mom's extended family, they're all pro-education. My dad's side of the family, they're all, engineers. My cousin's wife is a doctor. So, it wasn't that weird. But now in my own friend circle, I just remember this is going back to nursing school. I'd be studying for my A&P exam on Sunday when all my friends were at the park playing volleyball. And it was hard. It was just really, it was a lot of sacrifice that, I just wish that some of them were doing the hard thing too. I felt so
not just
alone.
You.
But yeah, no, even when I remember when I was in high school, Ron and Hilka Samra, they stayed with us, and I was talking about becoming a lawyer. This was maybe even earlier in high school. I was talking about becoming a lawyer, and nobody ever said, "Oh, you don't want to be a lawyer." I would feel that temptation to tell a young person, "Oh, you don't want to be a lawyer. Become an engineer, please." But maybe I just the way my brain works, maybe I just tune those people out. But I didn't ever feel any lack of support or encouragement.
That's good to hear. Yeah,
I know. I think so too. Yeah. And as far as like men's roles and women's roles, just not really in our culture. And maybe it's just because it's the time that we are now. But I just don't feel like the Christian community. Yeah. They feel like women can do pretty much anything as well. Now, a lot of young women choose not to, and that's okay. Sure. I hope, and this is my plug for supporting I guess, women in education or even young men in education, just know that you don't have to become a bricklayer because your dad's a bricklayer. There are other options out there. It's just easier to become a bricklayer if your dad's a
Sure.
bricklayer. So
you have more of a path understood.
Exactly. So that's the piece. I think that there's no dentists in our church because there's no dentists in our church.
There's not like exposure. And, you know, to be completely honest, one of my motivations for doing this interview series, aside from just hearing these interesting stories and learning a lot, is just to expose more people to things that maybe they don't get exposed to all that often, and kind of understand. I mean, I would assume that you and you know, others that I interview would be more than happy to help young people who would be interested in going this path, you know, and just kind of like chatting with them or giving them advice. And just knowing that there's someone out there that kind of already blazed this trail, right?
Yes, yes.
Is good. And you even mentioned Howard, how he you know, obviously was your dentist at one point, and I'm sure that there's some influence there as well. So that's, I guess, one of my goals with the video series.
Yeah, I would be willing to talk about dentistry to anybody who is interested. But now, like my youngest sister, Heidi, who's 22, when she was trying to figure out what she wanted to do for a living, I did encourage her to become a dentist. However, I did tell her, I said, well, why don't you become a hacker, a computer hacker, because I think that's cybersecurity is the wave of the future. But you know what? Computers aren't going to be for everybody. And so, and I understand that. However, I do think that it's a really good career path.
It's a very good career path. There's plenty of programmers out there making dentist money who are doing so with no degree. And that's,
I have two patients, they're a husband and wife team. They are software engineers, and they work remotely. So they've done all kinds of really wonderful trips, and they're able to work remotely. And there's just not a lot of other jobs that you can do that with. But not everybody wants to travel.
No, it's not for everybody. Yeah. And at some point, I'll probably talk about the industry that I'm in, some of the things that happen there. Maybe I'll interview Heidi. There's some interesting stuff that I'm sure she's running into, and she's just getting started with her career.
Yes.
But it is a very interesting one. Thank you so much. I mean, honestly, Kristin, this has been fascinating. We're getting Louise Kendall Johnson says, thank you for this interview series. I'm enjoying it immensely. And others have, Stephen says, Jamon, you've outdone yourself in this interview, or should I say Dr. Nordahl has outdone you? I would agree with that. Thank you so much for coming on and sharing. There's so much more. I mean, honestly, I could deep dive on a lot of this stuff, but we only have so much time. I do want to also just really quickly before we go plug the next interview, which is going to be next Friday at 4:00, which is 7:00 Eastern, 4:00 Pacific, not 4:30. With Steve Worry. And Steve, of course, is a pastor in our federation, but also he is an oil pipeline executive, and we're going to be talking about the oil industry. And I'll be asking him why he made gas prices so high. So we'll put him on the spot. But that's going to be kind of fun. Thank you so much, Kristin. Really appreciate it.
You're welcome.
Cool. And thanks everybody for coming, for all the great questions. And of course, if you're listening later, feel free to ask questions in there. Maybe there can be some additional knowledge transfer later as well. But thanks to everybody. God bless. And I'm going to try to figure out how to close this thing again, which is always an adventure. Okay. I think I clicked.